So today we're going to do a video on a topic that comes up very frequently in my visits with patients, and that is, why am I not losing weight on this medication? Why am I not losing weight as expected with bariatric surgery? So patients focus a lot on the number when I see them, and we have to focus more on the concepts. So I want to get into these two separate topics like a little bit differently. When we talk about bariatric surgery, a lot of times the reason why a patient isn't losing weight as much is because of hydration or protein, more bariatric principles. So I'm going to get into that in an upcoming video on bariatric surgery and why you're not losing as much weight as expected. But when we talk about a medication, and I think now, well, actually really all of the medications, but particularly the GLP agonist, the Zepbound, the Wegovy, those kind of medications. Those medications is what we're going to talk about most frequently, but really any medication that's out for weight loss, like the older ones, I mean, they used to be the newer ones, but now they're the older ones like Contrave and Qsymia, even phentermine, those that are out. They all have to be titrated to their dose, and particularly the GLP agonists. There is a titration. And what does titration mean? Titration means that you start at a lower dose and then you increase to the quote therapeutic dose, which is the actual dose that should cause weight loss within a few months. So with all these medications, you're starting off at a lower dose, and the reason why you start off at a lower dose is purely just to avoid side effects. So if you were to start off at the therapeutic dose, that dose that is going to cause weight loss, you would have side effects, nausea, vomiting, and it probably wouldn't be tolerated, and then you would want to stop the medication. So that's why we started at a lower dose, so that patients can get used to it, the body gets used to it, and then we get to the therapeutic dose. And the therapeutic dose is the weight loss dose. So I think a lot of times patients are not aware of that when they start the medication. So they'll start it, they'll be taking it for a few weeks, and they're like, Dr. Berger, I'm not losing weight. And well, that doesn't happen with my patients, because I actually tell them that we're going to get to the therapeutic dose, and I actually have that discussion with them. But okay, so say maybe, they have a doctor that didn't tell them that, and they don't understand that, then they're going to be really frustrated at the beginning, and they don't understand that they haven't gotten to the weight loss dose. Now, once we get to the weight loss dose and they're maybe not losing as much, that could be because they're a drug non-responder. So some patients just do not respond to weight loss medications. It's something that's an ongoing study. Researchers are studying it now. Some patients are just drug non-responders, and I see that all the time in my practice, that some patients just don't respond to weight loss meds. And in those patients, I'm really quick to bring up the topic of bariatric surgery, because usually when they don't respond to one particular medication, they don't respond to other medications. So an option for these is to obviously talk to the patient. I mean, they always need to be working with a dietitian. I always have patients have clearance from their dietitian before I start them on a weight loss medication, because I want to make sure that they're understanding the basic principles and that we're just adding on the medication to help them in the weight loss process. So they're meeting with the dietitian, they're doing all the basic principles. We want to make sure that that's in place. They're staying hydrated, they're taking in protein. And if they're still truly not responding at all, and when I say responding, I look at two things. I look obviously at the weight loss when they're at the therapeutic dose, and I ask a patient, what is this medication doing for you? And some patients actually feel like it's working, it's making me more full, I have less cravings, I think about food less. Then I'm actually going to try and work with that particular medication a little bit more, because I do feel like there is some benefit because the medication is working. Yes, sometimes it may be a placebo, but in most cases, it's obviously doing something. And then we have to weigh, is it a placebo or is it actually doing something? And then I'll go more by the number, if that makes sense. So, but if I ask a patient, what is this medication doing for them, and they have to struggle to tell me what it's doing, then I'm much more prone to switch to another medication or bring up bariatric surgery. Another option is if they're losing weight on, say, a GLP agonist such as Wegovy or Zepbound, and they're not losing enough, then we can consider, and when I say enough, just meaning, at least 1 to 2 pounds per week. And again, it's more of a percentage wise, but I really look like for a substantial number per week or a substantial number per month. Again, I'm not about like numbers. I don't go for percentages when I'm talking to patients, but I want there to be like a chunk of weight that I'm really noticing every single time that they're coming in, and then we address that. So if not, then we can always add on another medication. So that's something to think about. And again, this is only in a patient that is responding to a weight loss medication, meaning by numbers and by symptoms. Another thing that patients have to understand is that and I went over this in another video, is as you're losing weight, your body is adapting. So the BMR, the basal metabolic rate, is decreasing, and that is appropriate for the weight loss. So BMR is based on your height, your weight, and your age. So your height and your age don't change much, but your weight is changing. So as your weight goes down with weight loss, the body is adapting, and the BMR, the basal metabolic rate, is also going down. So as you lose weight, you can't just keep cutting your calories. You actually need to increase your activity. And when I say increasing activity, that doesn't necessarily mean exercise. It could also be something called NEAT. And NEAT is non-exercise activity thermogenesis. And what that basically means is like fidgeting, getting up every hour, or even like shaking your leg or that kind of thing. Just those little activities that actually add up to the amount, could be up to 500 calories a day. So NEAT tends to go down when patients lose weight. So the body just becomes more sluggish. You tend to like do less activity. And so that naturally occurs. So you have to kind of focus on NEAT. You have to focus on making a patient more aware of just like increasing their walking. If they have a sedentary job, you want to make sure that they set a timer and like get up every hour, or, print something or go talk to a coworker instead of emailing them, or pace back and forth when they're on the phone, or park farther, all these little things. And if they're sedentary because of medical reasons, meaning they're more chair bound because of medical reasons, even just moving around in their chair. I've told patients that I have in wheelchairs, just moving around more in your chair, they can enhance their weight loss. And as I always say, remember to be patient. So all the time I see that patients lose weight differently. Some patients just lose weight consistently every single week. They're losing weight consistently. I have other patients who lose weight, then they plateau, then they lose weight again, then they plateau. And we just have to figure out what kind of patient they are. So the key is patience. Your patients need to be patient. And what I also mean by that is that they have to understand that weight loss ongoing and weight loss maintenance in itself is amazing. So once you've lost weight, in order to maintain it, it really takes a lot. And to always remember, and I see this again a ton in my patients, is that there's no all or nothing. If it's always funny, like in December or January, I'll see a patient and they've gained like 30 pounds. And they're like, well, it was the holidays. I'm like, well, the holidays were just really technically Thanksgiving, Christmas or Hanukkah or New Year's, really just like 3 days. So why did you gain 30 pounds? Because it's more so that all or nothing thing. I got off track on Thanksgiving, so now I'm going to get off track for the next 3 months. And there's nothing wrong with that as long as you get back on track. And what we always tell patients is get back on track as soon as possible as you can, and realize that if you can be good, 6 days out of the week and you have one bad day, then that's great. It's better than having 7 bad days or 6 bad days or 5 bad days. Just, try and make as many good days as you can with general weight loss. Okay, so those were things I wanted to bring up. And definitely subscribe, and definitely give me, put down questions about what your tips are on weight loss maintenance and losing weight beyond plateaus. And let me know if you have any questions about that. But first, I just want to check and make sure that yes, okay. I did go over everything that I wanted to. The only other thing that I also wanted to bring up was the fact that sleep is an issue for a lot of patients. So making sure that they're getting proper sleep, and protein and hydration. You know, those things, if they're not staying hydrated, or if they're not getting in an adequate amount of protein, that can also stall the weight loss. So thanks so much for watching, and I will see you next week.